My name is Lauren Trevis, and this is my report entitled Differences in Wrist Flexor and Extensor Activation During Different Types of Muscle Contraction. Before we get into the meat of this lab experiment, there are a few different concepts that are necessary to understand. First off, the study employs the use of surface electromyography to measure voluntary contraction. Previous research has shown that electromyography is the most reliable way to understand activation of muscles during movement. Additionally, surface electromyography, or EMG, has been found to be more comfortable for patients, as well as easier to apply. These considerations were important given the location and short period of time given for data collection. Lastly, one study discovered during literature review found that concentric EMG intensities were higher than during eccentric contractions. The overall purpose of this study was to better understand the magnitude of muscle recruitment during concentric, eccentric, and isometric contractions of muscle. The hypothesis was that percent maximal voluntary contraction would be higher during concentric contraction than during eccentric and isometric contraction. Recruitment for this project took place at Regis University in Denver, Colorado. The inclusion criteria included being a member of the Regis Physical Therapy class of 2021 and being between the ages of 20 and 30 years. Exclusion criteria included skin sensitivity to surface electrodes and current injury of the wrist or hand. The result of recruitment was 8 total subjects, 5 females and 3 males. The average age was 25.12 years, with a standard deviation of 3.04 years. During data collection, participants were seated with their arm resting on a table with about 90 degrees of flexion in the elbow. Next, the patient was asked to flex and extend against resistance, while our research assistant palpated for the wrist flexors and extensors. Once located, the corresponding areas were shaved and cleaned with rubbing alcohol. Electrodes were placed over these locations, and a fifth electrode was placed on the biceps, acting as a sort of a ground. Maximal voluntary contraction of the flexors and extensors were measured with EMG during manual resistance on the part of the researcher. Then isometric, concentric, and eccentric contractions were performed for both wrist flexion and extension while the subject held a 5-pound weight. Maximal voltage was recorded for each trial, and individual percent maximal voluntary contraction, or MVC, was calculated so that results could be compared between participants. Average percent MVC and standard deviations were also calculated. These results are depicted in both Table 1 and Figure 1 in the results section. In the graph, the different contraction types make up the horizontal axis, and the average percent MVC in volts is represented on the vertical axis. As you can see, the wrist extensors, depicted by yellow bars, showed peak average percent MVC during concentric contractions, whereas the flexors, depicted by blue bars, showed peaked average percent MVC during eccentric contraction. In fact, based on the calculated averages, the flexors showed the least percent of MVC during concentric contraction. Isometric contraction resulted in the lowest average value of percent MVC for the extensors. So what does this mean? Well, it means our hypothesis was not supported, and our results conflict with the results of the Key et al. Study, which found that the most EMG activity occurred during concentric contraction. However, this study was performed on the biceps brachii and not on the wrist, so that may have to do with the differences found in our studies. The amount of activation in the extensor and flexor groups during movement may affect ratios of co-contraction. This ability for the muscles to co-contract is crucial for proper performance in functional tasks. Research has shown that co-contraction ratio is task-specific. In fact, levels of wrist extensor activation has been shown to vary during different functional tasks, even when both tasks require flexion of the fingers. This may also help to explain our results. This information provides knowledge that will be directly applicable to clinical practice. For instance, patients coming into the clinic may have abnormal muscle activation patterns. Inability to use proper levels of percent MVC may result in decreased force production and decreased functionality. Knowing how much percent MVC muscles should have during types of contraction can help us diagnose and retrain. Thanks so much for taking time to listen, and have a great rest of your day.